In this scenario, we will see a hospital chaplain visiting with a 40-year-old patient in the hospital after complications from ovarian cancer, including uncontrolled nausea and vomiting related to a partial small bowel obstruction. The patient is joined by her spouse and is the mother of a very young child. It is very important for her to be around to see her child grow up, so she's willing to try any treatment available if it affords her more time with her family, regardless of any short-term adverse effects those treatments may have on her health.
Hi, I'm David. Nice to meet you. Hi, Sue. Hi, I'm Chaplain David.
Hi, I'm Cheryl.
Hi, Cheryl. It's nice to meet you.
I'm Brad.
Hi, Brad. Good to meet you. I'm so sorry to meet you guys under these circumstances. This is incredibly difficult, I'm sure.
Yes, it is.
Yeah. So what have they told you about your medical condition currently?
Well, they said I have probably a couple months.
Oh, wow. Well, that's going to make these next couple months very important, isn't it?
Absolutely.
Yeah, I'm so sorry. You know, I don't want to try to pretend like I could even imagine what this is like for the two of you to be going through. But I do want to bring a couple questions today that are going to be very difficult things to talk about, but I think they're important because what we want to talk about is what's going to happen for the next couple months. And one of the things I wanted to ask about is an advanced directive. Do you know what an advanced directive is?
Yes.
Do you have one written out?
Mm-hmm. Yes, we do.
You
Yeah. I think it was a while ago, but we have one at home.
You do?
Mm-hmm.
Brad, maybe next time you go home, you could bring that in for us.
Sure.
What I'd like to do is look at that and make sure that it's current and up to date with what your current wishes are.
Oh, okay.
Because as your situation changes, we want to update this information to make sure that it's reflecting exactly what you do and don't want to have happen medically. I've brought a form today that I'd like to show you too and go over with you.
Okay.
It's called a Polst Form. And Polst stands for Physician's Order for Life-Sustaining Treatment. P-O-L-S-T. And what this is for is this is a form, they made it in this bright pink, so that if anyone is looking through your belongings or at your home or looking through your chart, they know exactly where this is. And what this is a brief summary with boxes checked that will let a physician or a nurse or an EMT person that would come into your house know exactly what your wishes are in a very quick time. So there's 4 different sections here, and I thought I'd go over them briefly with you. The first one is whether or not you would want to have resuscitation if your heart were to stop. Now, you know what CPR is, I assume, right?
Mm-hmm.
Compressions on your chest.
Mm-hmm.
And what we're trying to ascertain here is if your heart were to stop and your breathing stopped, would you want them to allow you to just die naturally, or would you want them to attempt to resuscitate you?
I would say resuscitate.
Yes, resuscitate.
Right. Yeah. And you'd want to be resuscitated, I would imagine it has to do with your little boy.
Oh, absolutely.
Yeah.
I want to be here as long as I can for him.
Yeah, what a sweetheart.
Yeah, that's the hard part.
It's got to be. It's got to be. So what we'll do is we'll check right here in section A, we'll check the box that says attempt resuscitation.
Okay.
Now what that means is that in section B, we'll go right down to full treatment, so that they will do everything they can to bring you back to consciousness and to get things rolling, whether it takes medications, any kind of palpations, whatever is necessary. And section C is about administering artificial nutrition, and there are some options with that. If you get to a point where you can't be fed by mouth, then we would have options to feed you with a tube.
I really wouldn't want the long term. I've been really nauseous and vomiting, and that's why I'm here right now. I just can't keep anything down. Yeah.
Yeah.
So
You know, that's something.
I would probably go with the trial.
Good.
You think so?
I think so.
And that would be a great thing for you and Dr. Frost to discuss.
Oh, okay.
Because what I'll do is I will take this, and section D is about the signatures. What I'll do is I'll take this and discuss with Dr. Frost what the content of our conversation was. And then he'll come in and probably want to just reconfirm those things from you. and then he'll be able to sign this, and it will be an official document for your chart.
Okay.
And hopefully what we're trying to do here is give you a chance to really control the medical interventions that happen and the medical interventions that you don't want to happen as you spend these last few months.
Okay.
So thanks for going through this with me. I know it's a very difficult time.
Some of the key Polst principles that you just saw are: Polst enables patients to select whatever treatment they want, including aggressive treatment, and avoid those treatments they don't want. Patients may choose to try a feeding tube for a defined period of time to see if they improve. It is important to understand a patient's goals of care and how their values affect their treatment choices. What do they hope a certain treatment will achieve for them? What is important in their life? What brings their life meaning? Polst may be completed by a healthcare professional, but must be signed by a physician and the patient or his or her decision maker in order for it to be valid. Polst complements but does not replace an advanced directive.